Hello and welcome to episode 4 of Below the Hospital. For those of you that don't know, this is an AMI podcast on sterile processing and the issues that sterile processing technicians face today. I'm your host, Garland-Rhea Grisby, Interim Assistant Director for Sterile Processing and Endoscope Service Manager at Kaiser Permanente. I'm also a long-standing AMI member. Today, I have the pleasure of speaking with Tori Ruiz. And Tori is an Area Director of Sterile Processing at Sutter Health in the greater Silicon Valley of California. She's a seasoned sterile processing professional and Air Force veteran who has also contributed as a committee member to AMI guidance documents such as TIR 99 for ultrasound probe processing and TIR 109 transporting sterile devices. Tori, welcome to Below the Hospital.
Thanks, Garland.
So today's topic, how ambulatory surgery interacts with sterile processing in the surgery center setting. So Tori, just to kick it off with question 1, right? Can you tell us a little bit about work in ambulatory surgery at Sutter Health? So basically, what does your day-to-day look like?
So my day-to-day is, it's not really a day-to-day. Every day is completely different. For me, I have responsibility over 7 surgery centers, just the sterile processing portion of it. So it just kind of depends on what's happening on any given day. Some of my centers have wonderful SPD managers that do handle a lot of the, I would say more of the day-to-day stuff. I do a lot of helping with bringing in education, building process improvement projects. Standardization is a big thing right now, really working on how we make sure that every patient going to every Sutter facility is getting the exact same standard of care at every facility. So that is a really big push right now and a really big thing that I really want to make sure that we're doing, because if you're going to, center number 1 over here, and then you're having something else at center number 5 over here, you should be having a very similar experience because we're all Sutter, we're all one team working together, and it's great like that. So I do a lot of that. And every once in a while, I have hopped in here and there when we were short-staffed to help out. I still know how to do all the things. Sometimes it takes me a little bit longer because it's been a minute, but I definitely make sure to keep my, skills up.
And that is great because we do have to keep our skills up, especially if we oversee certain areas. I appreciate the fact that you said process improvement and standardization. That is truly something that a lot of folks need, right? We shouldn't have to pick which facility or healthcare setting we want to be in because it may be better than the other, especially if it falls under the same name, right? We want to be able to go and get the same care under that same facility. So that being said, how does your department interact with SPD on a day-to-day basis? Now, I know you said there's no day-to-day for you, but how does your department interact with SPD?
So it just, like I said, it definitely does depend on the day and what's going on. I do a lot of walkthroughs, go through the centers, even though I am at that, I'm on a regular basis, but making sure that, looking through, doing a walkthrough with either a manager or sometimes just a technician, asking some questions, making sure that I'm paying attention to the education that's needed. If we're bringing in a lot of, new grad technicians, which, does happen a lot, making sure that we're doing back to basics a bit more often. We're working right now on a summer education day where all of our techs at all of our sites can go, on a Saturday and get all their CEUs. We have educators coming in. We're hoping to do one in the fall as well. I'd like to grow that eventually into, helping out other non-Sutter folks if necessary, working with our HSPA chapters on that, stuff like that. But yeah, we do a lot of the interaction that way. Definitely when something happens, maybe there's, we've all worked in sterile processing, there's maybe a leak somewhere or sterilizers break down or, maybe something happens. It's usually a leak when it's raining real bad or, something that happens like that, or a pipe burst somewhere, and then working on logistics on if we need to be moving things to another center, or if, because we help each other out, making sure that everybody's able to continue with their day and really serve our patients, because that's what we're all there for.
That's good. And it ties back into what you mentioned earlier, right? Everybody doing the same thing. Then you can actually help each other out without having to worry about if the process is going to change or if there's going to be deviation from it. And I'm sure that the technicians appreciate seeing you come through to do the walkthroughs, because a lot of times what I've heard from many technicians is they feel that senior leaders or upper management don't know or care about what's going on in the department. So I'm sure they appreciate seeing you there. Now, what about other departments in the surgery center?
So in the surgery center, it's normally just the surgery center by itself. So it's, that's the operating room area, the pre-op PACU. So just like in a regular hospital, but on a smaller scale, our sterile processing would be interacting with them exactly the same way. If pre-op uses an instrument that needs to be sterilized, they'll interact with them that way. They use SPM to track things, putting away, pulling cases with the OR staff usually. If anything happens when they open a tray in the OR, they'll call SPD. That works fairly similarly to in a hospital. The big thing is it's much smaller. There's a lot less people. You tend to know each other a little bit better, which can be a good and a maybe bad thing sometimes. But there's also different centers that are even smaller where some of the SPD techs might have joint roles. So they may be helping turn over ORs as well, or helping out partially as anesthesia tech, stuff like that, in their not downtime, but kind of their role encompasses more things. I think in surgery centers, there's really a good thing because you get a lot of chances to learn new things. You work closer with each staff member. SPD techs may actually get to know a surgeon here and there because it's a bit smaller. Getting to know physicians and nurses and OR techs and pre-op and PACU nurses, all of the staff it's really nice because in a hospital, there's a lot of times that SPD tech is, I'm gonna say down in SPD because we're in the basement a lot.
Below the hospital.
We're in SPD and they may not ever go to the OR, or they may only go up there to deliver things and then go right back. They may never speak to a physician. I think it's really nice and something I'd love to see in more hospitals, getting the physicians a little bit more involved in sterile processing. I think I have seen a lot of people in my SPD network that are doing that. And I love it, inviting them down to tour, walking them through processes, inviting them to give education to techs so that they know what the instruments are being used on. Because rotating all of your SPD techs through the OR to watch surgery is not always a feasible plan. So, right. Yeah. And then we also do the clinics. So we process for our clinics. So if we have one big building and the surgery center is a portion of that building, all of the clinics in that building will likely send, some of them will send their instruments to us for sterile processing as well. And that works a little bit differently because that has to be done after hours and it can't be done during the ASC hours because you don't want to be mixing. So basically ASC volume goes first and then clinic stuff may be processed afterwards. And then we have, that's kind of what we do. All that stuff.
You bring up a good point, having that split time or role, so to speak, although you may be a sterile processing tech by trade, but being able to go and watch cases or get to know the physicians and the nurses is a pretty good thing. And it's a big deal, honestly, because most technicians, they don't know what the instruments are actually being used on. They don't know why the physicians need what they need. And so them actually being out there on the field and seeing it, it's kind of the light bulb, like, it makes sense now. So that's good that you guys have that process in place. A lot of more folks should implement that. And like you mentioned, yes, in the hospital setting, it's difficult. It's doable, but it's something that should be part of just basic training. So is there anything that you wish that SPD or sterile processing people knew about your area or your department?
I think not just SPD or sterile processing, but I think a lot of people think surgery centers and they say, I want to work there. That's a cake job. I'm going to be able to go, be off at 3 p.m. every day, and maybe every other Friday we're going to be off. And that, I won't say that doesn't happen at some surgery centers. Absolutely. But I will say that surgery centers have definitely grown, hugely just in, the cases they're allowed to take. We're doing more high acuity cases, big spine, big ortho. And a lot of that, it gets brought in. It's great. It's great for, of course, for volume. It's great for, of course, everybody wants to, make money so that we can pay everybody and continue working. But the bigger part of it is, we have these small sterile processing departments that are, revamping a little bit here and there. I think it's really important to know the hard work that's going into that. And even though in hospitals, even that I've been in too, you never have enough equipment or enough staff, or,
right.
You're always running out of space, but it's even more so in sterile processing in the ASC side usually. So you definitely have to, there's a lot more creativity going on, but creativity in where they're still, working so hard to meet the standards. Like I said, a patient going to a hospital and a patient going to the surgery center, they should still be getting the same surgery. They just get to go home at the end of the day for the surgery center, and I think another thing to understand is a lot of people are, people working in hospitals right now get worried when surgery centers are taking on the larger cases. Well, they're going to take our cases. Yes, some of the caseload may move to a surgery center, but the idea there is that those are healthy patients. Those are patients who don't need to be staying in the hospital. Right. It gives them much lower chances to get a health acquired infection, not be infected, not be around other patients that are there longer. And it should be making room in the hospitals for them to serve the truly hospital needing patients, who do need to stay there longer, who have more comorbidities and all of that stuff. So I think it'd be nice if everybody kind of knew a bit more of that. You don't learn a lot of it until you've been, on the surgery center side for a long time. And I'm lucky enough that I have been on both sides, and started as a surgery tech. So I have an insider perspective on that. So that's really nice for me, but not everybody is that way. So I think really just asking questions and talking to each other and networking, making friends at conferences. And when you're doing the video webinars, if you can't attend a conference in person, a lot of them have these little rooms, break times where you can go and chat with the other people attending. And I think that part is really important. And a lot of people don't necessarily take advantage of it. So, and things like this, listening to a podcast, if you're approached and asked to participate in a podcast, do it. Ask some questions about the company you work for, make sure they're okay with it first, but then do it. Chat with people. Nobody's trying to call you out on these podcasts to say you're not doing your job right or anything. People just want to know and want to learn, and this is how we do it.
Thank you. And that's a good point, because you heard it here, right? You just mentioned about surgery centers and basically offsetting the deficiency, folks being worried that, okay, the surgery centers are taking our cases. But the reality of the matter is, again, offsetting the deficiency. You mentioned not having a sufficient amount of equipment in hospitals and in surgery centers. So it's basically a help, so to speak. And then seeing just the process overall, just make way for improvement. So that's absolutely great. So in your experience, what has helped you to maintain a good relationship with SPD and to keep things moving smoothly, or as smoothly as possible?
I think remembering my roots is really important. Remembering being a tech. I definitely worked my way up from the bottom to the top. I did not get handed anything along the way, which was mostly not fun along the way, but I think really made me better in where I'm at now. I think it's really important that we remember that, and not only talk about remembering that, but show it in our day-to-day, making sure that we're taking the time to stop and chat here and there with people. Our schedules get really built up. I have a lot of meetings going on. It's a little crazy, but if somebody asks me for time, I'm always going to find a way to give it to them. I might not be able to give it to them in that moment. I might let them know, absolutely, I can go give that to you, in 2 days from now or something like that. But making sure that no matter who it is, if they're asking for my time, I'm giving it to them and I'm helping them with whatever it is, they need help with.
Yes. Definitely time is much appreciated. I actually appreciate you taking the time to even chat with us here on Below the Hospital. So in your experience, what would you say are important factors for keeping patients safe and avoiding hospital-acquired injuries or infections?
I would say education all around. So, network and education. So, talking to your infection preventionist, whoever that is, making sure that you're partnering with them when new things are happening, new surgeries are coming in, new equipment's being put in, who's buying that for you. It's making sure our users are involved in that. If you're the only SPD tech, for example, at a surgery center, and you're not in management, which they sometimes aren't, but that new surgery is coming in, you need to be talking to your leadership about that. Make sure that they know that, you're bringing in total knees and maybe you don't have a washer in your surgery center yet, and because that sometimes tends to get overthought. People don't always notice. They say, oh, they can get the instruments through for this small ENT case. Let's get the other ones through too. So just talking about it and then just bringing in the education and looking for the education. You got to do that on your own sometimes. So seek it out and do it because it's very important.
Yes. Thank you for mentioning education. We can't say that enough. And you mentioned earlier in the outset about going back to basics. Sometimes we coast along and we forget the basics. So going back to basics, and again, like you mentioned, being aware of what's coming in, if it's new, even if it's things that are upgrades, right? There may be a slight change in process. There may be a slight change in what's required from the manufacturer. So we need to make sure that we are educated regardless if it's, like you said, that minor ENT case. So in your role as a member of AAMI Steam Sterilization Hospital Practices Working Group, you've done some work on AAMI standards. Now, in your experience, what do hospital-based or surgery center-based practitioners bring to the standards development process?
Well, definitely a user view on everything. So when the technical experts are in there talking with all the numbers and all the stuff that honestly it's hard for me to understand. I have to read more about it, look it up in order to understand. Making sure that a user is in there and saying, oh, that's really nice idea, but that's not going to work because this and that have to happen first, in the department. I think users and industry folks working together for the standards is so important, and it's great that we have a much more. I think we now have a much more even mix of people doing that. So, I have hopes, and I think that the standards are getting better and better. I, for one, have been using them for many years, and until I started working on them, I didn't understand them as well. So it's definitely helpful to be in the room with people talking back and forth about each and every word on every line and what it means. It really helps to understand them a lot. So lots of people should be into that and getting into it.
Yes. So users, if you have not joined or been part of any of these working groups for these guidance documents, it would be wise to do so. You can understand how they work, you can understand the ins and outs, and you can actually have your input. So want to give a huge thank you to Tori Ruiz for taking time to sit and chat with us on episode 4 of Below the Hospital. Again, I know time is really important, so we really appreciate you doing that for us. So, folks, as usual, I hope this episode was useful. We'll be back in 2 weeks with another episode. If you want to support the podcast, you can find us at Below the Hospital on Spotify, Apple Podcasts, YouTube, and AAMI Array. Until then, see you when I see you.